I think what you're trying to balance is the ideal amount of testing with the practicalities of trying to get some sort of treatment out there for people that need it. The fact is that right now there is a great need for some sort of treatment, and we have published reports, peer-reviewed journals, et cetera, on what we'll call, let's say, allopathic or Western treatments that seem to be effective. One example is remdesivir. At the other end of the spectrum are substances like artemisia, which is what you're referencing here with COVID organics, where it's thought to be helpful by the people that are making it and maybe even the governments that are putting it out. But the evidence is really non-existent at the moment. And so could it be useful? Sure, it's possible, but we don't have any solid evidence that that's the case.
And as with a lot of vaccines, I mean, people are looking for, they've got their hopes up about this. And we've seen several African countries ordering large batches of this COVID organics. What are some of the dangers that can arise from this?
Well, a number of them. So, I mean, the first thing is that any chemical compound, whether it's in a drink or whether you're taking it as a pill, anything you take, you want to make sure it's safe and you want to make sure it's effective. So let's take them in turn. In terms of safety, it's very possible that anything you take could actually harm your body, even though it might be considered natural or organic. There are a number of natural, I'll put in quote, natural substances that are out there that can actually cause the first thing. You want to make sure it's safe in the doses that you're taking them. The second thing is effectiveness. You don't want people to take this, believe that they're immune or believe that they're going to be safe, and then go and spread the disease even more. So I think there's a false sense of safety you can get when you don't know if something actually works. When people, oh, go ahead.
No, I was going to say, so then is that any different from some of these pharmaceutical companies, as we've seen with Oxford University, already ordering large batches of things that are still going through human trials, though?
It's a great point. And, a lot of things that are going through human trials, the gold standard is a randomized controlled trial. Before you even get there, there are things like observational studies. Let's have someone take a medication in a hospital setting, closely monitored, and let's see what happens. And when you get case reports that things are working and you believe it's working because of a certain substance, that begins to give you some sense of safety and some sense of effectiveness. We need to start seeing that with this product as well.
So we've seen that Madagascar and other Indian Ocean countries are arguing that Western medicine refuses to accept traditional African medicine. What's your take on that, and why does that tend to happen?
Well, there's a number of reasons why that tends to happen. I think there's a sense that, when you have something that hasn't been studied or well documented, that it's not real or scientific. Of course, that's bunk. That's not true. In fact, artemisia is a really interesting example because we know that it's the core behind where we have current treatments for malaria. That's where they come from. And so a lot of treatments that we have out there right now began with observations of things that seem to be working in the natural world. Plants and trees and things like that that actually have healing properties. We take them, we study them, and then we figure out how to make them more effective. So this is no different. It just hasn't gone through any process.
And we know that the World Health Organization says that it's looking into the efficacy of this treatment for Madagascar. How has traditionally the WHO's relationship been when it comes to traditional medicine? Do they put as much sort of funding and priority on traditional medicines as they do with some of these other ones going through pharmaceutical companies?
It's a great question. A very common thing that people think is, gosh, if it's something that you can grow, then people can't make a lot of money off of it. So there's going to be less interest in going after and studying that thing. What I will say is that there is a lot of truth to that. Whenever you're trying to invest in something new, you want to see if there's going to be partners. WHO doesn't work in isolation, and they definitely work with pharmaceutical companies and others that help fund this stuff. With artemisia, there's a company that makes this product as well. So, let's not kid ourselves. There's a commercial interest at play. But having said that, historically, I think that we have seen much more focus on classic Western scientific kind of approaches rather than Eastern approaches. And that does not mean that Eastern approaches don't work.
And I will say there does tend to be now a lack of distrust, especially in some African countries, over potential vaccines from the West. We did see that in the case of Guinea during the Ebola outbreak. We saw a lot of health workers suffering from that distrust. Why is that?
Yeah, I totally understand that there is a lot of distrust. I think that what happens is people see science as a proxy for colonialism. You get Western ideas or ideas from other countries being imposed and not really working with local leaders. And that's a real problem because once that trust breaks down, nobody really wants to kind of come back to the the scientific table anymore because they think, oh, it's just another way to kind of rule over us, which is terrible.